Sometimes life lets you down and you feel that you are done. You just want a morning run because the fun is all gone. But sometimes life makes you proud when you look far and wide, when you leave the pain behind and see the brighter side. TNC gives you inspiration. TNC reignites your passion. TNC starts your transformation. TNC helps you see the new you.
The new channel. The new channel. The views, opinions, and insights expressed in the following show are those of the hosts, producers, guests, and viewers. They do not necessarily reflect the position of the channel. Viewer discretion is advised.
Hello and welcome to the new channel.
We're here to help you see the new you. This is Mike,
And Nyce, Alvir,
COVID survivors, live streaming from Pasay City. You are watching COVID Stories.
Good morning. Maayong aga sa akon mga pinalangga nga kasimanwa sa Iloilo, Capiz, Negros, Antique, Guimaras. Maayong buntag sa akong mga amigog amiga dinha sa Butuan. Maayong buntag.
Good morning, everyone. Welcome to our show, COVID Stories. We're really excited at today because our guest, we've had him and as our nurse,
Yes.
taking care of us from the city of Pasay, the health office, and we're really excited right now, together with his fiancée, Dr. Angela Rivera. Our guest right now are a couple, a lovely couple. See, Dr. Angela Rivera is a doctor at the National Center for Mental Health, and Nurse Miko Llorca is the head in the City Epidemiological Surveillance Unit.
In Pasay. They are special to us because he took care of us when we were sick also. This was last March. And we call them the modern heroes of 2020. We emphasized their work because of the need that we have for them starting especially early this year. So
So, without further ado, let's welcome our guests, Dr. Angela Rivera and Miko Llorca, Nurse Miko
Nurse-
Llorca.
Hello. Hi, good
Hi.
morning.
Good
Hello,
morning.
good morning.
Welcome.
Thank you
So
for
we
having
get-
us po.
Yes, of course. We are privileged to have you today, this morning with us. Can you please tell our viewers for this morning kung sino si Nurse Miko at saka si Doc Angela?
Yeah. Um Ako na lang muna. Sige. Miko Llorca. I'm Miko Llorca. I work as a public health nurse under Pasay City Health Office. I am the team leader of Pasay City Contact Tracing Team. So ever since this pandemic started, we've been working nonstop po in giving service to our COVID patients in Pasay.
And my name is Angela Rivera. I work as a psychiatric resident at the National Center for Mental Health. I'm also the backup singer for one of the backup singers for Hey Moonshine.
Yes. So welcome.
Okay, let's start this. Can you tell us about your COVID journey? How did you find out? How did you guys find out uh, about the disease? How you got the disease? How it
Yeah.
started?
hmm I got it. I actually found out that I had COVID because that was last March, and we were contacted by the triage that we had to undergo quarantine because we had exposure, but we didn't know where the exposure came from. So we were triaged and classified as, back then it was PUM or PUI. So I had cough and cold, so I was considered a PUI. I went into quarantine, and si Miko was like, told me, "Oh, bakit you have cough and colds? I think you have to get swabbed." So I had a swab. We both did, and I tested positive for COVID. So I really didn't know. I really didn't expect it to turn out positive because I did have allergies and I would have occasional cough. I never had any fever. I never had any body weakness. I just had cough and colds occasionally. So when we found out, we were we were, we were so shocked actually. We immediately contacted the landlady of our apartment, contacted the training officer of my residency. We contacted the barangay because we wanted to let everybody know that we had to go on quarantine and they had to get themselves tested.
Yeah.
Nurse,
Uh,
Nurse Miko, what was your first reaction when you found out that Doc Angela was positive?
Actually, mas feeling ko pa that time, mas ako pa yung tatamaan because of my job. Kasi I work hand in hand with COVID positive patients talaga. And back then, I really was not expecting to test negative. When I received the results from our ITM, parang nag-ano pa ako parang nag-double look pa, uy, okay, so positive. So parang back then, nag-ano pa kami, parang nag-decide pa kami na, nag-usap na kami back then na, okay, what do we tell our parents? Diba? Should we tell them? Kasi back then, talagang if you are COVID, big deal and panic talaga. Lalo na malalayo kami sa isa't isa. So medyo matagal namin pinag-usapan. And humiwalay na rin. I mean, we are living in a studio, loft type na studio. So dito na siya sa taas nagstay. Ako doon ako sa baba. So pag nag-uusap kami, lang, parang rinig lang ng boses. Naririnig ko lang yung boses niya. Ganun.
LDR.
Long distance relationship.
Long distance
Oh,
by
si
10
Attorney Carlo pala. Oh, hi Carlo. Attorney Carlo is watching.
From Hey Moonshine, the bandmate of Dr.
Yeah,
Angela.
from YOLO then, YOLO.
Yeah.
Okay. So what was your first steps for the since you're exposed, you found out about Dr. Angela's being positive. So what did you do for yourself naman? Did you have yourself tested?
Immediately we separated, so he had to stay downstairs, and when we decided that was gonna stay here sa top floor, sa upper floor no loft. And then yeah, we contacted our landlady, we contacted the barangay, and we contacted the medical training officer. Who did you contact
Yeah,
from work?
may office mates, of course, my boss in the city health office. I also contacted our supervisor because actually back then ano pa eh talaga when you get swab you have to go in quarantine, di ba? So that time pa lang sabi ko na sa kanila we have to Angela received the message that apparently she got exposed and then we needed to be tested. So nag-quarantine ako. That was late March, I think.
Yeah.
That was late March. And then we received the results, I think, back then kasi medyo matagal pa eh, yung resulta. I think a week. I think 1 week after, no, we received the result na positive nga. So, immediately, she contacted her supervisors, her contacts, and ako rin, I informed our office, no, with regards to this because yun nga, I work as a surveillance officer. So may mga case hindi na ako makapag-field, no. So isa yun sa mga naging rin po namin, naging challenge namin, no, with regards to
Siguro yung pinakamadugo doon was me trying to contact people I interacted with. Kasi the time na I wasn't in quarantine yet, I wasn't symptomatic yet. Pero paano yun? Was it a few days after the quarantine when you noticed that I had cough and colds?
Yeah. If you remember before, hindi rin yung testing capacity natin, hindi rin siya masyadong not for everyone. I mean, if kung kailangan talaga mahirapan ka makapagpa-swab before.
Noong time na
yon, oo. And then she got symptomatic. Na lang parang iniisip ko nga rin allergy lang kasi nga ganun naman siya lagi eh, may sinisipon. So pero since she received niya a notice na she's possibly a contact. So nag-ask na kami ng help sa local government dito sa Mandaluyong and sa Pasay para makapagpa-test po kami. And then nagpa-test kami. And actually back then lahat ng guidelines natin interim, so bago-bago. So hindi pa talaga malinaw kung saan dapat kahit sa quarantine eh. Kasi kung for example ngayon nangyari sa amin ito, definitely bawal siya mag-home quarantine. Talagang nahanapan siya ng facility. Lalo na we are sharing one CR. Wala kami talagang separate room kasi nga loft kami. So before at least kahit papaano napayagan kami, nagpaalam kami, napayagan naman na dito lang kami. Thankful din kami sa apartment, sa landlady namin, very supportive naman.
Totoo yan, tuwing March, pag galing namin sa hospital, Nurse Miko, naalala mo, tumatawag ako sa inyo because parang there's a, how do you call this? Yung place namin, they didn't want to accept us. Parang sinabihan kami na can you just transfer to your other
home? Oh, yeah. Yeah, I remember that. Oo.
Tapos parang you sent someone, I remember you sent someone to explain to the PMO, or I'm not sure if it was you.
It was me, actually.
Yeah. Yes. Explain, remember? Ganun siya kagabi.
Sumbong kami na sumbong sa'yo.
Oo.
Kasi may story talaga dati. You're so scared of the virus na parang lahat na lang na meron, kawawa na lang eh. Kung discriminate na talaga eh. Kung even at in your own home, parang kinakatakutan din talaga even if you close the door. You just open the window lang a bit or the door, wala, takot na talaga sila.
Tawag ako ng tawag sa inyo, remember? Tapos parang, palagi ako nagsusumbong hanggang later on, they received an email daw na, someone explained to them na this is how it goes, it's not like that. And then when we got home, like what you guys did, we also separated. Pero for some reason, nahawa pa din kami. Yes, kami lahat.
Yun nga, minsan nakakatulong talaga na kung understanding, like you said, your landlady, that's really good. At least yun, supportive talaga siya. So nakatulong din yan sa atin na kunyari nagkasakit
Actually,
tayo.
yeah. Kasi nagbabawa siya ng stress.
Agree.
I mean, you worry about a lot of things. Tapos kung pati ba naman yung place where you stay, problemahin mo pa, di ba?
Basic needs na yon is shelter, and if you're deprived of that when you're sick already, parang nakaka-devastate pa lalo.
Yes. So remember, so you separated from each other. One is how did you go about your daily activities? I mean, you did you monitor your temperature? Did you how did I don't know how did you do it? Parang in the coming days that you started to be isolated from each other.
You were
Yeah,
quarantined.
And then, yeah, this
definitely may daily temperature monitoring, and nagsa-self-auscultate din kami. Di ba?
Yeah.
Remember?
Mm-mm.
We'll self-auscultate if yung lungs namin clear, ganon.
Yeah. And basically ako yung nagpe-prepare ng food talaga. And very thankful kami sa Mandaluyong and Pasay City government kasi nagpapadala sila ng supplies.
Oh yeah.
Yeah. Mandaluyong nagpapadala sila ng gulay, talagang baboy, manok, mga prutas. Yung LGU ko po sa Pasay, mga friends ko from work, dinadalan din po kami ng supplies. So kahit pa paano, we were kasi hindi na kami nagkaroon ng time to prepare back then. Wala nang hindi kami nakapag-stock up ng supplies eh. So talagang I didn't even have to ask, no. May colleagues in Pasay, no. Alam na nila, nagpadala sila ng supplies. Mandaluyong city government, ang bilis din po ng response. So kumbaga na lang talaga, ang pinoblema na lang namin back then was sana wag mag-develop talaga ng severe symptoms si Angela. Because she has asthma kasi, which is actually high risk. So, ayun. Plus, 'di ba yung mga neighbors namin, may mga neighbors kami dito na na
So nag-ask ng permission sa amin yung landlady namin because she had to tell the building that somebody in the apartment had COVID. So she asked for my permission if she could tell one of the neighbors. I was like, sige, okay lang po. So that neighbor contacted me and she even prayed for me and she would give us food. She would leave the food at our doorstep. Tapos she would text na, hey, I brought you some food. Go get it on the door. Tapos nakakatuwa. Tapos yung friends na I haven't seen in such a long time, they would come send us food yung from the club.
Yeah.
Ang laking bagay nakaka-boost ng moralidad.
actually.
Totoo yan, yung Pasay LGU, they are very helpful and supportive sa atin, sa amin also. Ang dami nila pinadalang pagkain. Kasi we were not able to go out of the house. Apat lahat kami.
Kasi kami yung case number 2 and
Yes.
Isang sako ng bigas, tapos may lemon, may gulay, may how do you call raw food.
Oo. Grabe, no. Tapos back then, ang dami ring 'di ba, reports ng ng discrimination.
Oh yeah.
With kasi I mean, 'di ba, bago lahat sa atin to. So
everybody's scared.
Hindi nila alam kung anong magiging reaction. So may mga bad experiences yung ibang tao sa barangay, sa government na 'di ba, na-discriminate sila kahit sa mga landlady nila. Nung nangyari sa amin to, medyo medyo may part sa amin na
do I tell them? Do I not tell them?
Yes, kasi nga dahil doon mas marami yung report na na nadi-discriminate. Pero syempre, it's our duty pa rin talaga to be responsible and to report. So yung trabaho ko po sa disease surveillance, we've been training for this. I mean, for how many years? So pero kahit na anong training namin, parang nung nangyari sa amin, oops, okay, parang hindi siya enough talaga.
Iba na pag actual.
Hindi ka talaga mapaparedy sa ganung situation. Parang it's
Parang
there na talaga. Parang totoo na to.
case-to-case basis also on how you would handle things and how, on what will you do.
That's true. Yeah.
So what was the worst thing na punta sa isip ninyo that during that time? Di ba sabi mo you got scared? What else? Ano yung parang mga scenarios parang naisip kayo before when you were quarantined while Dr. Angela had COVID?
Well, ako personally, I was scared that because I didn't feel any severe signs and symptoms, but I was afraid that I transmitted it to somebody who would have severe signs and symptoms. Kasi para ako talaga, I didn't even have any fever. Talagang occasional cough and colds. But if I had transmitted it to somebody who couldn't fight off the virus, I was scared that that person would be in the hospital, would be in the ICU, or would have died. That would make me feel so guilty na nangyari yun. I came into contact with a lot of patients.
Mhm.
Ayun.
Yeah. And yung isa pa sa pinaka-fear namin back then, pagka nag-develop siya ng symptoms, wala kaming hospital na mapupuntahan.
Oh yeah.
Yeah.
Kasi puno. Before, di ba I remember you guys sa St. Luke's. Tagal din.
Wala.
Di
Hindi
ba?
kami
Matagal.
Hindi yung tinrahin mo nga hanapan kami ng hospital. It's really hard.
Yeah.
Parang all
Mm.
over Metro Manila, tinawagan mo ng lahat. Wala talaga.
Yes, ang hirap actually. So, yun talaga yung pinaka-worry namin na pinagdalasal namin na wag sanang mag-develop ng malalang symptom kasi nga yun talaga problema yung hospital na paglilipatan.
Meron tayong viewer na nag-comment na thank you very much Sir Miko. Big help ka po sa family namin. That's from Arsenal Romero.
Oy, hello ma'am, hello. Good morning. Nako, thank you po.
Grabe yung tulong na naibigay mo being in the front lines.
Oo, sa amin, palagi lang parang magsusumbong, parang security blanket. Miko, ano ba nangyayari dito? Kaya tawag, Micaela, ganito, Micaela was only is our 5-year-old daughter. So, syempre, I'm so scared. Kasi lahat kami, yung nanay niya, tapos si Mike, and then me. Palagi ako tatawag, anong gagawin natin? Paano bang, ang kulit
So,
na.
malaking tulong ka talaga. Malaking, I still have to thank you. I can't thank you enough sa tulong mo. And you've touched so many lives. Even one of our viewers commented na talagang malaking naitulong mo sa kanila.
And then there was a time na parang I was kind of guilty kasi when we found out na you were on quarantine, sabi ni Nurse Miko Flores,
so,
we were scared na yung naghawa sa'yo kasi you stayed with us for probably 2 hours in one of the swabbing sessions.
Dahil ayaw ng bata magpa-swab.
So we were scared na baka sa sobrang tagal na sa amin, kami yung naghawa sa'yo. Yan yung isa sa mga guilt feelings ko at that time. So it's good to know also your story.
Okay. Yeah, oo, actually. Yeah, no naman. Talagang although alam namin yung trabaho namin talagang risk to but then
occupational hazard siya.
And very very special yung daughter nyo kasi technically she was the first she was our first child patient. So we were really talaga na we have to do this and kailangan kahit 'di ba mahirap tiis we have to really test and take care of you guys.
Pinagtsatsagaan talaga yung ilang oras na para lang ma-test si Micaela noon. It was hard. I know it was hard for you, sobrang
pawis na pawis ka na, full PPE ka na, nakita ko talaga na
full battle gear.
Naawa rin ako talaga sa iyo noon. Parang sabi ko, wow. the sacrifice these people do talaga.
The frontliners, the nurses and doctors who do
Grabe.
this extra mile for the patients. No?
Yeah, so can you tell us naman, kunya sa part nyo, since you did it para sa amin, yung swabbing and all. So, syempre, during the time, protocol pa rin dati na you have to be tested so many times and before you are being, you are to be cleared. So, can you tell us about that experience?
Yeah.
Oh
How
yeah.
was it for you? Yeah.
So yung dating protocol was after you test positive, you have to quarantine for 2 weeks, and then you have to get another swab. Thus, you have to get 2 negative swabs for you to be classified as recovered.
Yeah.
So it took us how many swabs for me to turn out negative twice? It was such a long time. And wala na nararamdaman and you would still test positive. So parang you're hoping na, oh, I can return back to work na. And then all of a sudden, positive na naman lalabas. Ano?
Nakakatakot
Yeah,
yun,
actually,
Yeah.
yes. Oo, tsaka imagine yung stress of waiting, yung pa lang yun. Well, number one, yung stress nung swab. Kasi
Yeah,
sakit, di ba?
yeah.
I mean,
Sakit siya. Yeah.
it's really, painful or,
Yep.
yeah,
It's not something you want done to yourself repeatedly.
yes. So after, and then after that, yung stress naman of waiting for the result, na parang you're thinking na, uy, siguro magaling na to kasi wala na siyang
Wala na
symptoms,
symptoms.
okay na. Tapos biglang matatanggap naman yung resulta, positive ulit. So parang down na naman, and then, di ba? I remember my parents used to call us every day, every day.
Yeah.
Yeah, my dad who recently passed, siya yung madalas to every day naman tatawag yan, kakamustahin kami. They pray the rosary every day, etc. So ganun. So yung mga ganun yung nakakatulong pampa-relieve na stress, no?
And it took us 1 month ng quarantine for me to test negative twice. So it was a really long time.
Yeah, that's
And my mom's away also. My mom's in the States, so she couldn't come see me. She felt so helpless there. Every day we video call kami. Yun ang ginagawa na namin.
So from a frontliner's point of view, we will tell you. I would like to ask you what's your opinion about the misconceptions about COVID-19. Did you experience that you proved wrong in your experience? So we will take a short break, everyone. Please stay on our stream.
We'll be right back.
See ya.
Okay, before we bring back our guests, we would like to give some announcements. We would like to invite you to watch other shows here on the new channel.
The Big Picture shares inspiring stories of notable personalities, Mondays to Fridays, 7 p.m. HR Hotline introduces us to the wonderful world of human resources management, Tuesdays, Thursdays, and Saturdays, 12 noon. Have an insightful Saturday afternoon because the family business is everyone's business, 4 p.m. The fourth project is about life, business, and success stories live from Dubai, UAE, 6 p.m. or 10 p.m. Philippine time on Saturdays. Usapang Beauty is about beauty beyond what your eyes can see. Thursdays and Saturdays, 5:30 p.m. Discover your life purpose and learn from others' turnaround stories by tuning into U-Turn, Mondays and Thursdays at 10:30 a.m. The Home Buyer is where you hear remarkable stories about building and owning a property. Mondays and Thursdays, 4 p.m. Laugh and learn about puppetry arts from all over the world. The Puppet Stories, Mondays, 5:30 p.m. Magbenta, bumili at tumulong dahil bukas na ang TNC Marketplace, an online night bazaar, Thursdays and Fridays at 10 p.m. Yo Law is for all of us to understand that law is fun and equal. Thursdays at 8:30 p.m. Watch and learn about money and more streams live from the Philippines and the US. Tuesdays at 8:30 p.m. Philippine time and 5:30 a.m. California, USA. Two leaders in one platform, TNC The Talk, Mondays at 12 noon.
Okay, After Shift is a chillaxing show about your choices and lives after work. Wednesdays and Fridays at 8:30 p.m. Discover and learn strategies on self-leadership to win in life through Win Within. Saturdays, 8:30 p.m. Dream, achieve, nurture, and inspire. Tag your kids along and watch Danny Art Show Fridays at 5:30 p.m. Global issues, common interests,
Yes, okay.
learn together across borders. Foreign affairs streams on Tuesdays at 10:30 a.m. Because health is wealth, Healthline on Wednesdays and Fridays, 4 p.m. Start your Saturday celebrating the women at work, 9 a.m. Saturdays. Awesome day. Mondays at 2:30 p.m. Make sure to make your day an awesome day every day. In a world where everything is turning on digital, CyberNext aims to empower people and companies to be secure in a digital world. Streams Wednesdays at 12 noon. TechU helps you understand the emerging technologies shaping our future. Fridays at 2:30 p.m. Catch also our TNC original shows such as One Day, an inspiring 30-minute storytelling. It alternates with TNC Town Hall, co-hosted by TNC founders Lloyd and Apple. This show is where we talk to you, our valued audience, about our shows on TNC. And of course, the world has faced an unprecedented pandemic. Time to hear positive testimonies straight from those who recovered from the disease. COVID stories, Saturdays at 10:30 a.m. More upcoming PLC shows that will truly inspire you. Please follow our channel on Facebook and YouTube and let us help you see the new you.
Welcome back. You're watching COVID Stories.
Okay, let's welcome back Dr. Angela and Nurse Miko.
Hello.
Welcome back.
Hello.
Okay.
Yes.
Hi, everyone.
Hello. So, going back to where we left off, what misconceptions about COVID-19 did you prove wrong during your experience?
Yeah. Well, I guess the number one misconception that we proved wrong is that you cannot get COVID from an asymptomatic patient because I contracted it from caring for asymptomatic patients that I didn't know were COVID positive.
Yeah. And ano, and siguro one misconception din that we've proved wrong is yung once na malaman ng isang tao or certain number of people that you are COVID positive, automatic ano ka na kagad pandidirian or ma-discriminate. But that's parang kabaliktaran nung na-experience namin totally from our landlady to our neighbors to our to the LGU to our friends. Full support sila.
So at least hindi lahat talaga nagdi-discriminate. Buti na lang may mga may mga supportive neighbors and people around you talaga. So it really
Important,
helps.
yeah. Mas important din sa getting well and then road to recovery yung support ng mga tao sa paligid natin, mga kaibigan, yung LGU, the the people who would even just send us messages to make us feel better. Hindi lang enough na we are taking care of ourselves sa bahay, pero importante din yung environment na where we are at during quarantine because it helps a lot to our road to recovery.
And of course, can you also, I mean, give tips, kunyari, to our viewers, yun, para ma-prevent nila ma-prevent nila yung makuha ng COVID or anong kailangan lang gawin para talagang maging safe sila. So coming from a city, from the Pasay City Health.
Yeah. Always remember yung lagi kong actually sinasabi sa mga kasama ko. Alamin muna kung paano kayo mahawa, no? Droplet and yung mga bagay na nalagyan ng virus, etc. Kasi if you know kung paano kayo mahawa, you will know how to protect yourselves, di ba? That's very important. Kailangan din nilang maintindihan na no PPE is 100% safe or secured, di ba? Kahit na PPE ka, hindi yan 100% kasiguraduhan na hindi ka mahawa ng COVID. Kasi if you are careless, kahit na naka-PPE ka, there's still a chance na mahawaan ka ng virus. So, very important talaga yung pagiging self-aware natin sa paligid, sa mga bagay, and being responsible. Basic things like going out without a mask, yung paggamit ng mask, hindi pag-disinfect before doing stuff, di ba? Very important po. Yun yung hand washing, di ba? Hand washing, yun yung very basic na nakalimutan ng maraming tao for a long time na biglatang etong pandemic boom. Biglang eto lang di ba? Hand washing, mag-mask, physical distancing. So malaking bagay po yung mga yan. Yung mga basic small things like that po will really help.
And it's not an easy thing to do because we're a social group of people. Parang as Filipinos, we want to be with other people.
Yeah.
We want their company. So it's really hard for us to do these things. And plus, yung sometimes tinitipid natin yung sarili natin. So yung mga disposable masks, we would reuse it. Not thinking na, hey, yung konting pagtitipid natin na to, this can affect our health and in a really devastating way. So just really think of these things to take care of yourself.
Kaya nga there are yung mga government agencies, local government na nagbibigay ng supplies sa mga tao kasi malaking bagay po talaga yan. And we all know a lot of people were affected by this pandemic. Maraming nawalan ng trabaho, maraming nawalan ng kita, and sometimes talaga kahit na hindi ideal, hindi mo sila masisisi na magulit ng mask, magulit ng ganitong mga bagay kasi nagtitipid sila. I mean, pambili nila ng pagkain, di ba, etc. So kaya nakakatuwa rin na yung local government, etc. is tuloy-tuloy pa rin hanggang ngayon sa pagbibigay ng supplies. Maraming NGOs din. We also have friends abroad, mga kabatch namin nung college na ayaw magpakilala, na nagbibigay ng donations. So, yun yung mga ganyan, nakakatuwa, no? Nang ito lang natin nare-realize, no?
Important din yung compassionate yung mga tao during this pandemic times for us to be able to cope with this disease well. So yung disease na dito, hindi na siya enough physically. It also affects your mental health. Doc Angela, can you please tell us paano natin i-handle mentally yung times like this for those who didn't contract the disease yet and then those sa mga meron, paano natin i-deal to mentally also?
Oh yeah, definitely. This disease is mentally devastating, not just physically. So there is a need for sometimes kaya natin na pag napag-uusapan natin, there are people na pag napag-usapan, it helps them vent out the gravity of the situation na gaganahan na sila. There are people that are able to divert their attention to different things. Kaya nauso yung mga plantitas and plantitos.
That's true.
And
Marami na
Baking.
baking yung nauso. And then
Mm.
ngayon yung mga plantitas and plantitos because that helps them divert their attention, their stress away from the negativity and towards something more productive. But there are times when no matter what you do, the stress just doesn't go away. And that's all right. But you have to know na there are people that can help you. In our hospital, we have the NCMH crisis hotline. It's open 24 hours a day, 7 days a week. And you can call them and they can talk you over what you can do when it gets really stressful and parang in crisis ka na talaga. And you can also seek professional help naman.
Okay, so paano naman yung tips natin for a recovery? Kumbaga, what did we take during when during the time we had COVID? So, ano yung mga mabibigay nating tips naman sa mga viewers natin? What we did, kunyari, sa vitamins ba, sa pagkain pa, or ano pa bang iba natin ginawa na may impart natin sa kanila?
So, parang sa amin, basically, we just took vitamins, took ascorbic acid, and so vitamin C and healthy eating. But, syempre, kung mild symptoms lang yung naranasan ko, if it comes to moderate or severe symptoms, then you really have to seek treatment from a hospital. In that case, the treatment differs from person to person.
Yeah. And even though nag-recover na, no, one patient recovers, he or she should not be too complacent, no?
Yes.
Na hindi porket nagkaroon ka na, hindi ka na mahawa ulit. Hindi pa rin talaga malinaw yung studies about regarding that, ano pa rin tuloy-tuloy pa rin. So it doesn't mean na nag-recover ka na or nagkaroon ka na ng antibodies, hindi ka na mahawa. There's still chance. In fact, we've experienced reinfections of our some recovered patient, tapos na reinfect sila ulit after a few months. So ano pa rin talaga, kahit doble ingat, I mean lalo na ngayon, GCQ, di ba? Mas marami ng tao nasa labas. Yung pag nasa EDSA ka, parang wala na tayong community quarantine, di ba? Pag nasa malls. So, ano pa rin talaga, kailangan mag-ingat pa rin. Very important.
It hits you when your guards are down. Parang, okay, naka-mask ka, naka-face shield ka palagi, you don't take it off. And then, kakain na kayong sabay-sabay. Tatanggalin mo na yung mask mo. Biglang may umubo. Umubo siya. Ayun na. So, ayun. We really can't be complacent.
Totoo yan, Nurse Miko. Kasi kami, when we had our second negative swab test results, I felt like I was Supergirl na parang, okay, I can go out. I have I have immunity already. Yun yung sinasabi nila, matagal yung immunity mawawala. Okay, bahala kayo dyan, basta ako, hindi na ako mahahawaan.
Yeah.
But of course, we cannot be complacent nga, totoo yan. But for some reason, kasi you have overcome it, alam mo na paano gagawin, alam mo na kung ano yung experience mo na kayang-kaya pala natin siya labanan. Hindi siya
Yeah.
deadly, deadly, basta lalabanan mo siya talaga. Of course, you will not let the disease overcome you. Kailangan mo siya i-fight out. Pero tama yung sinabi nyo, na we cannot be too complacent about it.
And maraming studies nga lumalabas na maraming reinfection and actual news na mababasa natin na meron na talagang nahawa. So talagang ingat pa rin tayo kahit paano. So parang ako, I'd always tell my friends na parang this virus is here to stay. So we just have to adjust. So parang lifestyle na siguro natin yung mask na yan. Pinaka-basic talaga sa atin yan. Washing hands often. Yun talaga kailangan.
Yes. Yes, lalo na sa mga kids, 'di ba? Very very important siguro sa mga listeners natin, sa mga friends natin, lalo na yung may mga anak, yung may mga bata. Very important talaga na ma-instill sa kanila yung hand washing, proper hand washing, yung mga ganun kasi mahirap hindi natin ayaw naman natin na, 'di ba, na maging pabaya lalo na sa mga matatanda and sa mga bata,
Tsaka
which is mga high risk.
Hindi lang tayo yung affected. Pwedeng, kunwari sa atin, wala lang yung symptoms. Baka may mahawaan talaga tayo na would develop severe symptoms. Baka maiuwi natin sa family, sa loved ones natin.
Yeah.
Yan yung mas nakakatakot talaga.
I would like to agree with that kasi nung kami, there were 13 of us together, nag-dinner kami noon, nung nakahawaan kami. So yung isang kasamahan namin, he was really okay. Wala, asymptomatic siya. Ang lakas-lakas niya. Pero nahawa niya unknowingly yung dad niya, who is 82-year-old. So siya, okay siya. But naging parang, how do you call that? Carrier ba yun? Or basta siya yung naghawa sa dad niya, who is 82 years old. So tama yung sinabi niyo, Doc, na kailangan talaga mag-iingat pa rin tayo kasi maging okay lang tayo. Pero hindi natin alam, mahawaan natin yung ibang tao. And sila yung mag-experience ng worse symptoms than us.
Yes.
Actually, yeah, that's true.
So we'll pause for a short break and more stories when we return. Please stay on our stream.
Welcome back. You're watching COVID Stories. Happy 54th anniversary to the UP St. Hilary's fraternity. And one of the activities to commemorate such anniversary, we had blood donation, which was last October 14 in UP Diliman, UP Village. So we had
and it happened. It was
simultaneously.
conducted simultaneously with Batangas City, Pampanga, Zamboanga City, and Antique. We conducted that activities for the purpose to because of this pandemic, blood supply depleted,
Depleted.
and so we wanted to replenish it and encourage volunteers, encourage people to volunteer to donate their blood. And also happening today, this morning, happening also in Olocos, we also have a bloodletting, and also on the 31st, another site in Ilocos. We're conducting this, and we're trying to inform and encourage volunteers to please go to your blood banks or your local blood banks to donate your blood, because the blood you give today can save a life, maybe even save your family members in the future. Yes. And we'd like to say hi pala to Miss Alicia Llorca Argano, watching from
Oh,
Australia.
hi. Hi. Tita ko yan. Hi, tita. Tita Alice.
And she's really proud of you and Angela. And more blessings daw. Okay. Yeah. So remember, sana we were trying to encourage people right now. I mean, more than ever because of the depleting supply of blood. Please donate your blood. You may call. Um, you may contact any Red Cross or any DOH accredited hospitals with the blood bank to so you can volunteer to donate. You can also email us at bloodsparksforlife@gmail.com, and you may check out the Facebook page Blood Sparks for Life. Okay. How about we ask about convalescent plasma naman?
Let's ask Nurse Miko and Doc Angela. I'm sure they know more about it.
All right.
Before yun, oy, tsaka guys, ano rin, maganda rin sa katawan ng tao yung nagdo-donate ng dugo. Diba? Regularly. Oo, not just, hindi lang kayo makakatulong sa ibang tao, pati sa katawan nyo rin, maganda po yan. So, we encourage talaga, mag-donate kayo ng blood, no, para sa lahat.
Yeah. So, yung convalescent plasma is a treatment that they're trying right now for COVID. Kasi yung blood natin, meron yan dalawang parts. The red blood part and yung plasma. Yung plasma, that's where yung rich in immunity yon. Yung alam niyo yung pag nagpapa-rapid test tayo, we have the IgG and IgM. That's in the plasma. That's where the immunity is at. So what we do is we have our parang blood donation siya.
Nagbigay ka ng plasma.
Yeah, nagbigay ako ng plasma sa UP.
Oh, wow. That's so nice.
So sinacentrifuge yun. Or actually yung sa UP, yung ano yun, they extract the plasma already from your blood.
Mhm.
And yung plasma na yon, they give it to a patient with COVID kasi recovered ka na eh. So you have the immunity already. You have the IgM or IgG. You have the IgG already. They give it to a patient suffering from COVID to hopefully improve the symptoms para gumaling sila kaagad. It's still in its early stages. But
Pero maganda yung ano yun.
yeah, may mga magagandang results naman siya. But ayun nga. This is really
Doc, yeah. So, Doc, parang sinasabi natin na yung plasma, yun yung army ng katawan ng recovered patient. Tapos,
Yung-
if you donate plasma, yung army na yun, ibibigay natin sa may sakit na patient.
yes, para
the patient, the one who has COVID, recover or heal from the disease. Parang
yes.
ganun yung Doc.
And actually what I remember before, parang may hotline si PGH, si UPPGH na tatawagan. So for example, recovered patient ka, may parang requirement lang sila na isi-send mo. Tapos pag pasado ka, may nakapagsabit ka ng result sa kanila, etc. Sila mismo yung susunduin yung tao. May service sila, oo. Hatid sundo, galing.
At saka ang bilis ng process. Parang you contact them, they interview you. If pasok ka, they'll come get you. They'll schedule to pick you up and then bring you to UP, to
PJ.
Not PGH eh. Hindi siya
Ay,
sa
iba pa.
PGH.
Yeah.
Away from the patients siya.
Yeah.
So you know that you're safe there and they'll extract blood from you.
So, given this disease at the end, your experience as a couple, can you please tell us how this helped you, this experience, Doc Angela, strengthen your bond or as a couple?
Oh yeah. It definitely strengthened our bond. Di ba, when you get married, they say that you're supposed to stay through thick or thin. Parang feeling ko through thick or thin, ganun. Ano na bond na tayo nun.
Nasubukan yung cooking skills ko.
Oy, magaling ka magluto talaga. Aminin mo. Magaling talaga siya magluto. He's just being honest.
So you discover a skill that you didn't realize before, and then it was just enhanced of the experience.
Oo, yeah. And siguro ano na rin, test of alam ko naman na umpisa pa lang eh. That's why I asked, ni-propose ako sa kanya because alam ko sa sarili ko, I mean, whatever happens, di ba? Kaya ko and nandito lang ako for her. So, yeah, siguro mas itong nangyari sa amin, itong situation na to, mas napatibay lang lalo yung feeling na yun, di ba?
That's really good to hear. It's love story, COVID story.
Love in the time of COVID.
Yeah, so ganun. So any more we're about to wrap up. So would like to ask you Sana if you have some announcements or anything you want to share with the audience also. So as a nurse working for the Pasay City Epidemiological Surveillance Unit and for National Center for Mental Health,
Yeah.
doctor also. Yeah.
Okay. Kami po sa Pasay City Health, the Pasay LGU, marami po kaming programs for COVID patients. Marami na rin po kaming facilities for them. Mas napatibay pa po yung coordination namin with the barangay, with the regional and the national offices. Our mayor, si Mayor Emmy Calixto Rubiano, sobrang supportive po niya. I mean, first time po imagine 2 a.m., 3 a.m. calling to ask about the COVID situation, kakinakamusta yung mga kaso, etc. So, yun yung mga usually hindi masyado nakikita ng mga tao, how sincere the local government is on handling this situation. Pero ayun po, kaya kami sa baba talagang nagtatrabaho po kami ng maigi to show the people that we really care and we support them. And they marami ho nagkalat. So kung if ever man na magkaroon sila ng case or gusto nila magpa-swab whatsoever, they can always coordinate with the barangay. Libre po lahat ng swabbing namin every day. We have swabbing. Libre po yan. So wala pong problema. Kung magkaroon man sila ng COVID, may facilities kami. Lahat po free. From ambulance, transfer to the facility, to the food, etc. Lahat po yan. Aside from the patient, nagbibigay kami sa family. Lahat po ng support na pwede namin ibigay, ginagawa po namin. Ang request lang po namin, syempre sa mga tao, be responsible, mag-ingat pa rin, always ensure na naka-mask palagi, physical distancing, disinfection. So small things like that, we should help each other.
And really quickly, for our patients who are looking to go to their follow-up checkups, you can visit the NCMH Outpatient Section Facebook page. Or if you are in a mental health crisis, you can go to the NCMH Crisis Hotline Facebook page. They have the number there that you can contact. It's open 24/7. NCMH USAP. So NCMH Crisis Hotline. is open 24/7, and we are able to cater to your mental health needs.
Yeah. And also, please check out our band songs. Yung page namin, like nyo, Hey Moonshine. Listen to us in Spotify. We have a new song. It's called Mercy.
Wow.
Yeah, it's about it's about mental health din, diba? Yeah.
Cool. So nice.
Ang galing ng guest natin ngayon because not only are they the modern heroes, the frontliners, doctor and a nurse, but also inclined to art,
A rock
artistic.
star. Hindi lang frontliners, front acts pa din.
Ang galing nga eh. Doc Angela, if you would give your story, your COVID story a title, what would it be?
Through, ano ba? Through, kaya mo yan.
Hindi ko maisip.
Through thick and thick.
Thick and thick.
Will that go for both of you na rin? Yan na yung pinaka niyo. Siyempre, co-stars nila
Yes.
sa movies ng COVID story
Yes.
nila. So, Doc Angela and Nurse Miko, through thick and thin.
Yes.
Okay.
Sila yung leading lady and then yung isa supporting actor.
Magaling yung support niya. Grabe.
Magaling
Grabe
yung support
tulong na
talaga.
ginawa niya talaga na
Nakatulong sa
he
leading
really
lady.
cooked for her and took care of her,
na hone ang cooking skills.
Yeah.
So any last advice or anything or you'd like to say hello
Hello to
to our audience, our listeners, friends?
Ito muna.
Yeah, hello to my bandmates from Hey Moonshine. I think they're listening right now. My parents from the US are listening. Hi, Ma. Hi, Tita Lynn. Hi to my sister.
Yeah.
Hi to the Llorca family.
Yeah, may family yung relatives ko from Australia. May office mates from Pasay City Health. Yung mga nasa contact tracing command center. Hello. Yeah, and my friends and relatives and everyone. Hello. Thank you for watching.
Yeah, and si Bok din. Hi to Bok and Switchblade Manila.
Yes, Bok.
Okay, thank you so much for joining us. Thank you for saying yes to say and tell us your COVID stories.
Thank you so much, Nurse Miko, for taking care of us when we were sick. Doc Angela, thank you for sharing your points and advice. It has been an inspiring and informative morning. Hoping to see you all every Saturday at 10:30. Increasing one's awareness and knowledge conquers fears through different COVID stories.
Thank you. This has been COVID Stories. Bye. Hi, everyone. Hello to Scintilla Uris, Astrum Sentis, and Stella Uris. What to say?